Chapter 4, Operational. So, what the heck does operational mean? It basically, in essence, says, can you do more in the same amount of time? Or can you do the same thing repeatedly or faster or with less steps or have the same person do the same thing better and faster or have a different person come over and do it as well as the other person? It's operational. It's regardless of who does it. So if you think about it this way, if I hand you a calculator and you were using a pen and paper, you can do more math in the same amount of time, God forbid. You can reproduce it more effectively and you actually trust what you're doing better, right? So that would be an operational improvement. Does it cost more than pen and paper? I'm certain it does. Is it worth it? Probably. I don't see a whole lot of people not using calculators these days, right? So when you look at the problem that you help them solve, how does it help them do their operational components of it? Same staff, can they do more in the same amount of time? Different people do the same thing repeatedly. It's operations. How do we get it there? How do we deliver it? And is it repeatable? A good tip to use is to say, hey, if we've eliminated 7 steps and now your 14-step process is now 7, the time it took that same person, they can go do other things in the same amount of time and be more productive. It's an operational approach to both the problem and then the solution. The operational problem that this facility had was once these instruments left the operating room and got to sterile processing, they were extremely difficult and took multiple steps to get them cleaned so that they could be washed and reprocessed. It would take sterile processing several minutes on each instrument, and each instrument had 5 versions of it used in the room, and they had to test and inspect each one regardless of whether it was used or not. So there were multiple steps, and each one required magnification, a borescope stuck down in it. It was a lot of work, and there was a lot of rework involved with it because they would find it on the clean side of sterile processing and have to send it back to the dirty side of sterile processing. Multiple steps, multiple people involved, multiple sets of eyes. So, a quick pros tip operationally, when someone tells you, hey, we can remove 5 steps from our process and go from 10 to 5, ask them what they'll do with the free time that the 5 steps they just eliminated with my product will help them with. This goes towards the solution part in that bucket, but you're able to talk about what they'll be able to do with the time you just gave them back, the manpower, the staffing time that you just gave back, because now we're looking at upside. So these are operational problems that my product may help with that delivers operational help or solutions.